everyone. Before I present about journal article, I will introduce myself. My name is Siti Nurjanah. My class to be nursing. Okay, I will read to point the contents of the journal article. The first, title and writer. Next, the second is abstract. Next, the third is background or introduction. Next is fourth is methods. Next, the five is result. The six is discussion. Next, the seven is conclusion. Next, the eight acknowledgement. Okay, I will present my journal article entitled is Effect of Early Warning Score or EWS Tutorial Simulation on Nurses Knowledge and Clinical Performance. The author is Roshy Damayanti, Yanny Trisyani, and Nuraeni. And the second is abstract. The first is background. Background is the early of warning score or EWS system has been recommended for an early identification tool of deterioration. However, its implementation has not been optimal, one of which is due to the flow of knowledge and understanding of EWS among nurses. Purpose is this study I made to determine the effects of EWS tutorial simulation on nurses' knowledge and clinical performance. The third is methods. This study employed a pre-test, post-test quasi-experimental design with a control group. Purposive sampling was used to recruit samples 40 and 2 respondents each in the intervention group and control group. The data were collected using 2 questionnaires to measure knowledge and clinical performance, analyzed using chi-square, Wilcoxon, and Mann-Whitney test. The next is the fourth is result. The result that there were significant difference in the pre-test, post-test of knowledge and clinical performance in both groups. There was also a significant difference in clinical performance between the intervention group and control group. However, no significant difference in knowledge was found. The finale is the conclusion. Tutorial simulation EWS had an effect on increasing nurse clinical performance. Although there was no significant difference in knowledge between the intervention group and the control group, the intervention group saw a better value than the control group. EWS tutorial simulation can be used one of the training to increase nurse knowledge in clinical performance in EWS. Then the third point is background or introduction. Background or introduction. The effect of early warning score or EWS system is a bedside tool deployed for early identification of physiological deterioration by establishing numerical values of physiological parameters in which the result can be used to see patient condition. EWS able to predict who is a risk of critical illness. The early warning score or EWS system has been recommended for an early identification of deterioration. However, its implementation has not been optimal, one of which is due the low level of knowledge and understanding of EWS among nurses. The purpose of this study aimed to determine the effects of EWS tutorial simulation on nurses' knowledge and clinical performance. Then the fourth point is methods. In these methods, it is divided into 5 types. The first is research design. On the content of the research design is this study employed a pre-test, post-test, quasi-experimental design with a control group. The second is samples and setting. On the content of the sample and setting is purposive sampling was used to recruit samples of 40 and 2 respondents each in the intervention group and control group. The third is research instrumental and data collection. One, on the content of the research information and data collection is the knowledge questionnaire consisted of respondents characteristic and 12 questions related to the concept and implementation of the EWS in handling patient, showing signs of deterioration. The fourth is data analysis. On the content of the data analysis is the data were collected using the questionnaires to measure knowledge and clinical performance and analyze C-square Wilcoxon and Mann-Whitney test. The fifth is ethical consideration. On content of the ethical consideration is all respondents expressing agreement to participate in the study were informed of the objective, benefits, and procedure of the research. Then the 5th point is result. In this result, it is divided 4 types. The first the first characteristic of respondent. Next, the second difference in knowledge. The third difference in clinical performance. And the fourth clinical performance to early warning score. So that there were significant difference in the pre-test post-test of knowledge and clinical performance in both groups. There was also a significant difference in clinical performance between the intervention group and control group. However, no significant difference in knowledge was found. Then the sixth point is discussion. In this discussion, it is divided two types. Is the first effect of EWS simulation tutorial on knowledge. The second is effect of EWS simulation tutorials on clinical performance. The EWS simulation tutorial has a better effect on clinical performance than the EWS tutorial. Their results are in the weight loss 12 and 14 study, which states that stimulation models have a significant impact on clinical performance, which states that educational programs relate to patients' age in worsening situation can improve nurse knowledge and clinical performance in the inpatient room in handling clinical deterioration of patient in a simulation setting. Then the seventh point is conclusion. The result of this study showed that there was a significant difference in nurse clinical performance between the intervention and the control groups after implementation of tutorial simulation. In terms of knowledge, there was no significant difference between the groups. This EWS simulation tutorial can be used as an optional training method to improve clinical performance among nurses. Future studies should consider the modification of the intervention in the duration and post-test measurement for better outcomes. The eighth point is acknowledgement. This research project funded by the Health, Human Resource Development and Empowerment Agency of the Indonesian Ministry of Health. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.